Are you looking for a different type of healthcare? At Holistic Wholeness Institute, we practice something called functional wellness. Functional wellness is concerned with the root cause of healthcare issues, not just symptom management. Consider this. If you had a rock in your shoe that hurt your toe every time you took a step, what would you do? Would you just take an aspirin to relieve the pain? Or would you address the underlying problem and shake out the rock? At our clinic, we're passionate about helping our members remove the rock to become empowered and independent. But first, we're going to help you understand America's healthcare crisis and how the system is failing patients. We'll discuss some of the potential underlying reasons why you're not feeling your very best. And at the end, we'll give you a fantastic opportunity to book a one-on-one consultation to become a member at our clinic. At Holistic Wholeness Institute, our lead practitioner is Dr. Nancy Beliveau. She knows what it's like to not be listened to and was a victim of the broken healthcare model herself. She was given pills for every ill, only getting worse, masking the symptoms, not getting to the root cause. She helps her practice members to feel seen and heard. Each program is customized to the person and includes everything they need to help them feel their best again, naturally and effectively. There are 4 pillars of health: detoxification, hormones, nutrition, and fitness. At our clinic, we customize programs of care for our members to not only uncover the true underlying cause of their health issues, but also to empower them to take control of the pillars of health in an easy-to-follow, individualized manner. So why are we as a country so sick, sad, and overweight? Let's talk briefly about exercise. This is not exercise. Well, maybe for the dog. As a country, we need to build more muscle mass and move more, but a fitness routine that works for one person may not for the next. In fact, when it comes to certain hormones like cortisol, certain types of exercise can make the situation even worse. We'll talk more about this later. We're going to help you understand how to work out for your condition, and we're also going to build your body back up so you have the energy and drive to exercise. Next on our pillars of health, nutrition. Research is increasingly clear. Diet plays a huge role in maintaining health and managing chronic disease. But doctors in the conventional medical system only receive on average 19.6 hours of nutrition education across 4 years of medical school. There are many things to discuss in a jam-packed 15-minute doctor visit, so nutrition often falls to the wayside. There's no one diet for everyone. It's also important to consider food sensitivities, which are very different than food allergies. Food sensitivities are more chronic, less acute, and often more difficult to diagnose because of delayed reactions. The offending food may not cause a reaction for 48 hours or more. If you have symptoms like headaches, trouble sleeping, stomach issues like IBS or gas, skin troubles like eczema or rashes, respiratory issues like asthma or congestion, your health woes may be related to food sensitivities. At our clinic, we utilize proper testing and a detox to customize a person's diet and ensure they feel the best they can. Another major factor in your health is stress. Stress influences hormones, digestion, inflammation, sleep, and more. We think of stress in 4 ways: physical, chemical, emotional, and electronic. Physical stress, like car accidents or old injuries, can obviously impact the day-to-day quality of your health, and it's important to address underlying causes of physical stress instead of just medicating the pain. Emotional stress is firmly linked to health issues. Emotional stress is known to negatively influence blood sugar levels in diabetics and influence thyroid hormone levels. Electronic stress from our constant attachment to technology can cause issues with our circadian rhythm or our wake-sleep patterns. There is increasing evidence that disruption of the circadian rhythm can lead to certain cancers, metabolic dysfunction, and mood disorders like anxiety or depression. Because of its relationship to detoxification and hormonal imbalances, we are very concerned about chemical stress. The skin is your largest organ. The skin is a giant sponge, absorbing everything it comes in contact with, from household cleaners to pesticides to beauty products to the additives of tap water. Unfortunately, in our country, there's little federal regulation to protect consumers from chemicals with questionable safety ratings, including known or suspected endocrine disruptors, like estrogen mimickers and carcinogens. Our bodies are designed to handle stress, whether physical, emotional, chemical, or electronic. But there comes a point where a person's body is overwhelmed and suffers health consequences. It's important to build your body back up so you can better manage all types of stress. Hormones are chemical messengers that travel throughout the body, coordinating complex processes like growth, behavior, metabolism, and fertility. Look over this list of just a few of the known hormones. Who'd like to have more of the fat-burning hormones and less of the fat-storing hormones? It's a trick question. What you really want is everything in perfect proportions. Even tiny imbalances can dramatically impact the way you feel. If you suffer from a hormonal imbalance that causes stubborn weight gain, the distribution of body fat can provide clues to the type of imbalance, although proper hormone testing is crucial. We're going to discuss 3 specific hormones, the first of which is estrogen. Estrogen is an important hormone for both men and women, but if imbalanced, will cause extra body fat around the hips and upper thighs. High estrogen levels can be caused by a category of chemicals called xenoestrogens, an endocrine disruptor. These endocrine disrupting chemicals, like parabens, are commonly found in conventional beauty products, plastics, chemicals, and artificial food ingredients. Estrogen dominance, where there's more estrogen than progesterone, can occur throughout a woman's or a man's life, but is especially common during menopause. Blood sugar imbalances, like in diabetes, can also trigger estrogen issues. Estrogen issues can also occur when a person's body cannot detoxify properly. Cortisol is a steroid hormone that regulates a wide range of processes throughout the body, including metabolism and the immune response. It also has a very important role in helping the body respond to stress. But chronically high cortisol levels can cause weight gain, especially around the belly. It will also cause fatigue, depression, trouble concentrating, and blood pressure issues. If you have a thyroid disorder, understanding how cortisol impacts you is even more important, as high cortisol will lower your TSH, or thyroid stimulating hormone, block the thyroid hormone at its receptor site, and lower the conversion of T4 to T3, the only kind of thyroid hormone that your body can actually use. Thyroid is a hormone of great interest to many of our patients, as we see many people with hypo or hyperthyroidism. Hypothyroid issues can cause fatigue, weight gain all over, thinning hair, cognitive problems, insomnia, and generally make you feel terrible. Conventional medicine's approach is to medicate thyroid patients with a synthetic thyroid replacement hormone. But this approach does not address the underlying reason why someone isn't producing enough thyroid hormone. The truth is that 90% of hypothyroid causes are due to an autoimmune disorder, mostly one called Hashimoto's. With an autoimmune disorder, when the body's immune system attacks its own tissue, there are many, many natural ways to calm the immune system and better manage the condition. Lastly, we will discuss detoxification and its related organ, the liver. Your liver does a lot. Process chemicals, hormones, and medication, all while producing bile, activate enzymes, synthesizing protein, metabolizing food, and cleaning the body. When overwhelmed, a sluggish, fatty liver can cause a host of issues, including weight gain, fatigue, brain fog, and high blood pressure. It's not enough to tell a patient in this state to eat better and exercise, because everyone's needs are different. That is why it's important to do a proper, safe detox, as it will set the stage for the rest of your journey back to better health. One of the most common phone calls we get at our clinic is from new members who had blood work done and were told everything was normal. Being told you're normal when you feel terrible is so frustrating, but here is why it happens. The blood marker's reference range is defined as the values that 95% of the normal population falls within. And that range is determined by collecting data from all the lab's results. But you don't get your blood work done because it's a beautiful sunny day and you feel awesome. You get it drawn because you feel terrible. So normal is based on an unhealthy population. Functional wellness has tighter ranges that are based on studies of people who feel great and have no health issues. In functional wellness, we also test more of different lab markers. For example, most doctors in the conventional medical system only test one thyroid marker, thyroid stimulating hormone, as insurance typically will not reimburse for further testing. But this is an indirect, inadequate marker for thyroid status and does little except aid the doctor in determining how much synthetic thyroid hormone they should prescribe. Again, not addressing the underlying reasons why a patient is suffering with hypothyroidism. At the Holistic Wholeness Institute, one of our core philosophies relates to why versus what. Conventional medicine is worried about what you have. Hypothyroidism, diabetes, hypertension. At our clinic, we know a proper diagnosis matters, but we're also concerned with why someone has that problem. If you don't ask the right questions, or ask any questions at all, you don't get the answers. To get onto the path to wellness, it's important to treat the whole person with a clearly defined path. These are just some of the things we look at when considering the true underlying cause of a member's health issues. It's probably becoming pretty clear why you've struggled to get answers in the conventional system. But let's take a moment to discuss how America's healthcare system is truly handcuffing both patients and practitioners. Imagine a sink is overflowing and water is spilling all over the floor. Conventional healthcare runs down the hall, grabs a mop, and starts to mop up the floor. When the blood pressure goes up, a patient is prescribed high blood pressure medicine. When cholesterol is up, they get a statin. When they can't sleep, they're prescribed a sleep drug. Meanwhile, the sink is still overflowing because nobody has turned off the faucet. In the U.S., we spend more than $400 billion a year on pharmaceutical drugs, more than any other country. And while some of these drugs are life-saving, of course, many come with serious side effects for which patients are prescribed more drugs. In fact, senior citizens fill between 9 to 13 scripts a year, taking an average of 5 to 7 drugs at a time. We've all heard the commercials. Got headaches? Take this drug. Side effects may include vomiting, diarrhea, and stroke. We throw money and prescriptions at health problems, and it's not making us any healthier. Among high-income countries, we rank worst in terms of health outcomes, equity, and quality. And we have the highest rate of death due to medical error. Physicians on average see their patients in 15-minute blocks, sometimes double booked, because primary care physicians are paid both by their employers and insurance companies, mostly in a per-visit model. They have one eye on you and one eye on the clock. The system rewards doctors who see patients in bulk. We want to make it clear we're not bashing these medical doctors. They are in general very passionate and care deeply about patients. We're concerned about the system they must operate in. Insurance reimburses for the system we just described, but it very often does not cover the things that common sense tell us actually creates and ensures health. It doesn't pay for a real education for how to manage your own condition. It doesn't help pay for healthy, wholesome foods. It usually doesn't pay for a gym membership. Insurance also heavily dictates what can and cannot be done to help a patient. Let's discuss getting started with the Holistic Wholeness Institute. Everyone always has so many questions about what we do. So we start you off with a free 15-minute consultation. We want to make sure that we're a good fit for what you need and that you're a good fit for our programs. We want to learn more about what you're going through, what your goals are, and begin to uncover what other practitioners have missed in the past. We can also answer any questions you have at this time. If you're a good fit for our clinic, we will then schedule your initial practitioner appointment. This appointment is done on Zoom. Typically, this appointment is $287. But because you've received so much pre-education by watching our webinar and doing the free phone call, it is discounted to just $87. If your spouse or significant other needs our help too, we block off a longer appointment time and do both of your wellness consultations together for $134. There are a couple of reasons why we do this initial wellness evaluation for only $87, as $87 does not begin to cover our practitioner's time. The first reason is that we want to remove any financial barriers for you coming in to see if we're a good fit for what you need. You will be the only patient on the practitioner's calendar for that hour. They will come prepared for your specific case, and all of their focus will be on you. $87 reserves your spot. There are a couple of rules for the appointment. Come on time and complete your paperwork in advance. Additionally, for your wellness evaluation, we ask that you bring your spouse or significant other to the appointment, even if they aren't being seen as a potential member. There is so much information sharing and decision making in that first appointment that it's crucial to have your spouse present, as it's hard to go back later and relay it all to them. So we ask that you not only bring them to the consultation, but also have them watch this webinar beforehand so we can dive right into discussing your case in specifics at the appointment. Common questions. The first is, do you take insurance? No, insurance does not cover what we do. Insurance covers the conventional system, which, as you already know, does not have the answers you need. The second is this affordable? Yes. We work with many different types of people, from retirees to single parents. If this is a good fit for you, we will find a way to make it work for your budget. Another question is the diet weird or exercise hard? Absolutely not. We believe in teaching people sustainable habits they can practice their entire lives. Nothing weird, we promise. Do you have to be local? No. We work through telehealth with practice members all over the world. We urge you to stop procrastinating and come in for this initial consultation. Most people spend months, if not years, pondering major life choices before taking action. What is lost in the downtime is a more vibrant, healthy life. Submit your contact information using the form on our website, and our team will be in touch to book your consultation. Thank you for watching.